What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to Season 4 of the Birth Squad podcast.
We're Dr. Ijeoma Bello and Dr. Kimeshia Thomas. We are two OBGYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to Season 4 of the Birth Squad.
Okay, so let's set the scene. You're having contractions, they're strong, they're getting closer together, and you know that something is happening. So you go to the hospital, right? Thinking this is it, this is the time, this is game day. And then after a quick exam, you hear you're actually not in labor. You can go home. But hours later, you're right back to the hospital. You're more in pain, you're more exhausted, and now things are moving fast. So what happened? Did your body change that quickly, or were you sent home too early? Today, we're going to be breaking down one of the most frustrating and the most common experiences that our pregnant patients have. It's when you're told you're not in labor, right? But your body is saying otherwise.
So I want to take a moment to kind of explain why and what's going on. Most of our patients, we're going to tell, go to the hospital when you have 511. So what does that mean? You're contracting every 5 minutes. Those contractions last at least 1 minute, and that happens for at least an hour. Because the theory is when you have met the 511 criteria, you're probably in labor. Now, here's the piece of the puzzle that can be tricky for some people. Labor is divided into two parts. It's divided into latent labor and active labor. Active labor is 6 centimeters dilation, and you're a well-oiled machine. Like, you're going to make predictable change. Prior to that, it could be days, it could be hours. And that latent labor looks different for every single person. And that's why hospitals will have criteria for who gets admitted and who goes home. And most places will say you have to be dilated at least 3 or 4 centimeters or your water has to break. And when this is the other piece that I think a lot of people don't understand, if you are less than 39 weeks, you have to prove it to us. So what does that mean, Ijeoma? Like, what does it mean that they have to prove it to us if they're under 39 weeks? Why do we say that?
Yeah, so 39 weeks is when a baby is considered fully term, because there can be some variation sometimes in our dating about the expected date of delivery. And so at 39 weeks, we know that this baby is most likely really completely developed, right? So let's say someone is actually 37 weeks, okay, and they're going into labor or they think they're going into labor and they're like 1 centimeter. We're not going to just be like, let's help your labor go on. Let's encourage the situation because we don't want to potentially induce or bring on labor for a baby that's not maybe completely well developed, right? Their lungs may need a little bit more time to develop. So we would rather it just be something that happens on its own rather than a medical intervention. So that's what Dr. Thomas means by proving it to us, right? Versus at 39 weeks, we know this baby is likely matured and ready for delivery anyway. And so there might be more likelihood that you'll have assistance, right, to helping your labor progress. Yeah.
And if you are in that situation and you're 39 weeks and you say, hey, I want an epidural, we're going to more than likely give it to you because Dr. Bello mentioned, you're probably fully term, right? But I do acknowledge how frustrating that can be. And I do acknowledge how disheartening it can be. You can feel like you're not being heard. You could feel like your pain is being ignored. But it's just the idea that labor is unpredictable and it looks different for every person. And hospitals have to have some guideline for how to decide who stays and who goes.
The other piece is, let's think about this. If someone is actually wanting less intervention, right? Maybe they're thinking they don't want an epidural. Maybe they're thinking they would not want augmentation with Pitocin and things like that, right? It actually would be better, in my opinion, to be at home and labor at home so that this can naturally happen. Unfortunately, a hospital is a limited resource place. So the system is taking into account how many beds we have, right? And how many people are coming in, right? So I hate to say this, but the fact of the matter is we have a confined amount of space. And so we can't necessarily have someone who's going to be laboring unmedicated without any intervention for 2, 3 days, which sometimes early labor can be 2, 3 days, right? And so that's just one of the other piece that sometimes it is, I think, beneficial to be at home, right? Until that 511 kicks in, when you should then be evaluated. And then, if necessary, admission would be indicated at that time. Yeah.
And think about it this way, you're going to be more comfortable. No one's telling you what you can and can't eat. No one's telling you where you can lay. Nobody's restricting you from getting in the shower or the bathtub. Because let's be honest, some hospitals don't have a bathtub and some hospitals don't have a shower in every room. And that's a large part of why people have doulas is to help them manage that early stage of labor so that when they're ready, they show up to the hospital when they're further along so that you're not there for that long, right? Hospitals come with an infection risk as well because we care for sick people. And like Ijama said, we want to minimize the amount of interventions that you get. We want your body to be able to do its own thing. The other thing I want people to keep in mind is think about a birthing center. A birthing center is only going to tell you to come in when you are close to delivering. Birthing centers do not have you labor with them for days. It's usually hours, and most people go home after they deliver within hours. So I don't want people to think that the hospital is not listening to your concerns, but I do acknowledge that can happen, right? That's the whole reason we talk about the disparities in medicine and the issues with maternal morbidity and mortality. So I'm never going to gloss over that, but we do want to kind of give you some context for why you might be sent back home. I don't know if Ijama, you want to talk a little bit about some things that people can do at home to like manage their pain prior to coming back. I think that's always like a good conversation to have.
It's totally safe to take Tylenol, right? You can take up to 1,000 milligrams every 6 hours. But to be honest, if you're truly in labor, that Tylenol is not going to work. So that's a good sign too, right? To know that maybe something is actually really happening. Other things you can do at home are like, getting into a hot shower, having your partner, doula, or loved one or support person massage your back, applying like pressure points into your back, your lower back can be really helpful. A warm towel, even being like in the fetal position on all fours and rocking the peanut ball or bouncing on an exercise ball. Those are all things that can be really helpful to do at home as you're going through that early phase of labor. The other piece I want to also bring in is that when you're in the hospital, right, one thing that the staff is going to be doing is monitoring the baby a lot more. And I'll tell you this, since fetal monitoring started, the rate of C-section also went up. However, historically, the data does not show that that has improved outcomes for those babies. So what does that mean? It means that because we see something, we got to do something. That's kind of how the whole system is working, right? Because if you see that there's potential distress, then a C-section might be more likely to happen. So again, these are other reasons, to be at home as long as you can, as long as it's safe to do so.
Mhm.
Yeah.
And try not to get discouraged. When you come in, you're going to go to an area called triage. Nurse is going to assess you there. She might check your cervix, or the doctor might check your cervix. They might check to see if your water has broken. And you might get a different answer from one person versus the other, whether or not they think you need to go home or not. And there's multiple factors that are playing into that decision. But just understand that try to ask as many questions as you can to understand what's going on. Talk to your doctor about that beforehand. When should I go to the hospital? Should I call first? Should I just show up first? And I always tell people do a trial run. If you've never been to the labor and delivery unit where you're going to deliver, you're not going to be allowed onto the unit, but at least know where it is so that when you are in pain, your partner's not driving all over trying to figure out where to take you. You guys kind of know exactly where to go and have a game plan for that moment in time.
Absolutely. And let me say this very clearly. Being sent home does not mean you're not in labor. Okay. Being sent home does not mean you're not in labor. It means that you're not in the phase of labor that the hospital admits for. And those are not the same thing. So I think, if you are discharged or the plan is not to admit you because, they don't think you're in active labor, ask these specific questions. Number one, what is the criteria for me to be admitted for labor? Two, when should I return to the hospital? What things should I be looking for specifically that lets me know I should come? Those are really two critical questions I think that will at least provide some guidance. And then the
Mhm.
third thing, too, is if you feel like you're not being heard or your concerns are not being addressed, I think it's totally reasonable. And I highly encourage you to just say this. I feel uncomfortable and I want to just clarify what the situation is and your recommendations. And repeat that so that you know that the person who's receiving this information understands where you're coming from, that there is some fear, there is some maybe misalignment of the understanding of the plan. And then hopefully in that moment, some clarity can be achieved as well. What do you think, Dr. Thomas?
I think you're exactly right because when you have these conversations, then you kind of understand how the system works and you can navigate it with intention. And I think that's important. And when things escalate, like when your pain gets worse or a new situation occurs, you know exactly when to come back. There's no guessing, there's no second guessing yourself, but you're moving with intensity, or excuse me, you're moving with intent and clarity is what I'm trying to say. And that's just really what we want to do with these conversations is give you a blueprint to navigate the hospital system clearly.
And the other thing I'll say for sure is let's put this into perspective. If someone is literally in labor, whether that mean early labor or active labor, they are in pain. And what happens when you're in pain? Sometimes it's hard to communicate to people. It's hard to actually share what you're feeling. It's hard to speak coherently. It's hard to advocate for yourself. So it is so important that you have someone there with you, a partner, a doula, your mom, your sister, your brother, whoever it is, your cousin, have them there with you so that they can speak on your behalf, especially when you're
Uh-huh.
exhausted or unable to because you're in the middle of a painful contraction. I think that is such a crucial and critical part of, protecting yourself in the hospital.
So thank you guys for listening. Hopefully this information is helpful for you. We're going to keep doing this every episode this season is just giving you some behind the scenes insider information because what's important to us is giving you this blueprint.